Welcome to Section 2 of Joint Health and Degenerative Disease, Recognizing the Signs of Pain. In the next 10 minutes, you will learn how to spark a conversation with owners. Understanding that pain does not always look like classic pain, ask yourself the question, do you know all the ways that pain can manifest? Dogs, and especially cats, are very effective at hiding their pain. This is a basic instinct for survival and can make it challenging for owners to recognize that their pet is in pain. You are relying on the owner's subjective interpretation of a behavior outside of the clinic. During your brief interaction with the patient in the exam room, the patient is often scared, unwilling to move or not moving naturally. Cats in particular will go from the carrier to the table, back into the carrier without setting foot on the floor. Pain has behavioral implications. Leading veterinary behavior specialist, Dr. Sarah Heath, notes the detection of chronic pain is a challenge for the veterinary profession, and behavioral signs can play an important part in dealing with these cases. Using behavioral measures to recognize pain takes a lot of practice and empathy, and behavioral changes may be the most reliable signs. We are all familiar with the classic behavioral changes associated with pain: overt aggression associated with handling, clear resistance to being touched or manipulated. However, there are diverse behavioral changes with chronic pain. It needs to be remembered that aggression is not the only potential behavioral manifestation, and in cases where individuals develop behavioral coping strategies in order to deal with the pain, it is possible for these responses to become ritualized and even compulsive in nature. Beyond aggression, individuals can develop behavioral coping strategies in order to deal with the pain. The range of behavioral responses can include repulsion, avoidance, appeasement, and inhibition. Accurate history taking and good clinical examination is therefore essential. Videos can complete the history and examination. We are constrained by a lack of time in the exam room. Not enough time for pets to relax and move normally. The value of a clinical exam for chronic pain is limited. Luckily, most owners have access to a smartphone. Videos in the home environment are incredibly valuable. Videos can help analyze behavior changes, movements that are perceived by the owner as challenging, i.e. stares, and normal daily movement. Particularly in the earlier stages of osteoarthritis, the signs and symptoms are rarely as clear as a limping pet. Owners can be coached on what to look for. Chronic pain from osteoarthritis can often be dismissed as a pet getting older or slowing down. Not wanting to go for walks, difficulty getting up, and decreased interaction with the family can be the same concerns that prompt quality of life and euthanasia discussions. There is a huge gap to be filled, which can help owners recognize and address chronic pain in their pets. Common signs of pain in dogs includes decreased social interaction, anxious expression, submissive behavior, refusal to move, vocalizing, whimpering, or howling, growling or aggression, decreased appetite, over-grooming or self-mutilation of painful joints, and changes in posture. The common signs of pain in cats includes reduced activity and lack of agility in jumping, decreased appetite, loss of curiosity, increased hiding, changes in urination or defecation, aggression, hissing or spitting or tail flicking, excessive licking, grooming, or stop grooming or has a matted coat, stiff posture, gait, and weight loss. Cats show more passive signs of pain. They're particularly stoic. Showing signs of pain could make a solitary survivor vulnerable, and therefore passive signs of pain are far more likely than the more obvious signs that we associate with canine patients. There has recently been new research into signs of pain in cats, resulting in a grimace scale, as in the image on the slide. There are some objective physiologic measures we can use to recognize pain: heart rate, respiration rate, and blood pressure, which is perhaps more useful for acute or postoperative pain. Being able to recognize non classic pain behaviors in addition to classic pain behaviors is important. The limited time with a patient in an exam room is insufficient to detect all types of pain. Owner observations can be the most important factor in helping you diagnose pain. Pain can decrease the quality and quantity of a pet's life. If we can help an owner identify pain, we can then implement treatment to relieve pain, increase mobility, increase interaction with the family, and extend life. Thank you for joining us. Our next session will be about preventing osteoarthritis.